Imagine walking into a doctor's office where the physician gets your diagnosis wrong 80% of the time. Sounds terrifying, right? Well, that's actually the reality for some of medicine's most complex cases. But Microsoft just dropped something that could change everything. Microsoft just unveiled an AI system that's 4 times better at diagnosing complex medical conditions than experienced human doctors. And before you think this is just another tech company making wild claims, let me tell you what they actually tested and how this could completely transform healthcare as we know it. So here's what happened. Microsoft built something called the AI Diagnostic Orchestrator, or MAI-DxO for short. Think of it as assembling the Avengers of AI models. They brought together GPT, Claude, Gemini, Llama, Grok, and DeepSeek, and made them work together like a virtual panel of doctors. But instead of egos clashing in the conference room, these AIs collaborate seamlessly to solve medical mysteries. The crazy part? When they tested this system on 304 of the most challenging medical cases from the New England Journal of Medicine, we're talking the kind of cases that usually stump entire teams of specialists, the AI nailed the diagnosis 85.5% of the time. Human doctors? They only got it right 20% of the time on the same cases. Let that sink in. On the absolute hardest medical puzzles that exist, ones that get published in medical journals because they're so complex, AI is getting them right more than 4 out of 5 times, while human doctors are basically guessing and getting 4 out of 5 wrong. But it gets even more interesting. The AI isn't just more accurate, it's also cheaper. Each case cost about $2,400 to diagnose with AI versus nearly $3,000 with human doctors. That's because the AI is more strategic about which tests to order. It doesn't just throw everything at the wall to see what sticks. Here's how it actually works. The system starts by analyzing your initial symptoms, just like a regular doctor would. Then it asks follow-up questions, but not random ones. It's asking the exact questions that will help narrow down what's going on. After that, it decides which specific tests you need. No unnecessary MRIs or blood panels just to cover all the bases. And as each test result comes back, the AI updates its thinking in real time until it reaches a final diagnosis. What makes this different from just asking ChatGPT about your symptoms is that Microsoft created what they call a sequential diagnosis benchmark. They specifically designed this to mirror how real doctors work through cases step by step. It's not just pattern matching, it's actual clinical reasoning. Now, Mustafa Suleiman, who runs Microsoft AI, called this a big step towards medical superintelligence. And when you hear that phrase, it sounds like science fiction. But what he's really talking about is an AI that combines the knowledge of the world's best specialists with the broad understanding of general practitioners. Imagine having access to a doctor who's read every medical journal, remembers every case study, and can instantly connect dots that might take human doctors weeks to figure out. The timing of this couldn't be more critical. Right now, in the US, about 7.4 million people get misdiagnosed in emergency rooms every year. That's not a typo, 7.4 million. These misdiagnoses aren't just inconvenient, they lead to serious harm and billions of dollars in unnecessary treatments and tests. Microsoft's been building toward this for years. Remember when they bought Nuance Communications for $16 billion back in 2021? That wasn't just about voice recognition. They've been systematically acquiring healthcare AI capabilities, launching tools for radiologists, creating AI co-pilots for clinicians, and now this diagnostic system that could fundamentally change how we think about medical diagnosis. But here's the reality check, and this is important. This system isn't ready to replace your doctor tomorrow. Microsoft's being extremely careful about this, and for good reason. They're working with healthcare organizations to test and validate everything before even thinking about a broader rollout. They need more evidence from real clinical environments, proper regulatory frameworks, and rock-solid safety standards. Dr. Dominic King, who leads health initiatives at Microsoft AI and used to work at Google DeepMind, called this the most thrilling project he's ever worked on. And when someone who's been at the cutting edge of AI development says that, you know something significant is happening. What's fascinating is that Microsoft reports over 50 million health-related sessions happening daily across their AI products, like Bing and Copilot. People are already turning to AI for health information. The difference is that now we actually have AI that can provide genuinely accurate medical insights, rather than just web search results disguised as medical advice. Of course, some people worry about AI replacing doctors entirely, but that's not really what this is about. Think of it more like giving doctors a superpower. Instead of spending hours researching rare conditions or second-guessing whether they've ordered the right tests, doctors could focus on what they do best: connecting with patients, providing care, and making the human decisions that no AI can make. The stock market's reaction has been interesting too. Microsoft's stock actually dropped about 4.7% since the announcement, but that's probably more about broader market conditions than this specific news. Investors are still figuring out what medical AI actually means for Microsoft's bottom line. So what does this mean for you? Well, in the near future, when you visit a doctor for something complex, they might have an AI assistant that's seen millions more cases than any human ever could. Your diagnosis could be faster, more accurate, and cost less. And for those 7.4 million people who get misdiagnosed every year, this technology could literally be life-saving. The transformation won't happen overnight. Healthcare moves slowly, and for good reason. We're talking about people's lives here. But Microsoft just proved that AI can dramatically outperform human doctors on the hardest diagnostic challenges in medicine. That's not hype. That's verified, tested, published results. We're watching the early stages of what could be the biggest revolution in healthcare since antibiotics. And unlike a lot of tech promises, this one comes with hard numbers and real evidence. The question isn't whether AI will transform medical diagnosis. It's how fast it will happen and who will be ready for it. What do you think? Would you trust an AI system that's 4 times better than doctors at diagnosis? Like and subscribe if you enjoyed the video.